Hi, my name is TJ. My dad died of overdose on January 1st, 2011, and my mom is a recovering addict. God helped my mom, and now together we are here to help you. Now let's talk recovery. Here's your host, my mom, Susan Sexton-Wood.
Hi, and welcome to Let's Talk Recovery. I am your host, Susan Sexton-Wood. We have today a co-host with us, Terri Bogue. She's been on a couple of the shows with us. She is the mother of an addict and has compassion and a heart to help those who struggle. Our guest today is Erika Brandenstein. She is an OBGYN and also has a heart to help those that are pregnant and in active addiction. I want to welcome her to the show today. Hi, Erika.
Thank you, Susan. Thank you. I'm glad to be here.
You're welcome. Can I ask you, what do you feel brought you to want to help those that are pregnant and struggling?
Well, I think it was definitely God that put that desire in my heart to want to help these women. I think they're marginalized and pushed away. They face a lot of judgment, and a lot of times it keeps them from wanting to come in and see a doctor and to get care. And a lot of times they feel hopeless, and through Jesus Christ, there's always hope. So I believe that it was God that put the desire in my heart to want to reach out to these women and help them during their pregnancies.
When someone comes into the office and they say, I'm pregnant, but I'm still actively using, what kind of procedure do you personally just start talking to them about, and what kind of help that they can get for that?
Well, first and foremost, I treat them with just as much respect as I would treat anybody who comes into the office. So they're not judged, they're not looked down upon. They're a patient who needs help, who needs a service. And so generally what we do, depending on what the addiction is, we try to get them into treatment. And we have a lot of local resources that we use to help these women. A lot of times there's underlying psychological issues going on, and we get them help in that respect. But our goal really is to get them into treatment and to get them getting consistent prenatal care so that they can take care of themselves and the baby. And then also just to encourage them that even if they are struggling, that's okay. We're still here for them. We still want to help them, and we still want to take care of them and their babies.
Recently, we had someone on the show that was in active addiction and spoke about being pregnant and just the struggles that she was personally having. And so we have connected her with you in hopes that as we work with her on recovery and to get away from being an active user, you can show her the love and the grace of move forward and still, get the prenatal that she needs. And she's very early into her pregnancy. And so that's one thing that we can do is connect, the dots when it comes to the doctor and some outpatient. And that's kind of what we're doing. We also have Terri Bogue, the co-host today. Terri, is there anything that you would like to ask Erika and talk to her about when it comes to the pregnancy and active use?
I think that a lot of what you said kind of filled me in on what you do, providing the service through being the physician. And you see so much judgment, and it's so hard, whether they're pregnant or they're not pregnant, for anybody that struggles with addiction. And so many people will look at, especially a mother, that has been using or is still using, and she's pregnant, and these children are born addicted, and they look at them like they're just ready to be taken out and executed. How do you encourage them to get beyond that? Because the judgment is debilitating, and being the mother of someone that struggles, I understand so much more about addiction than the layperson that looking at this mother like she is just a piece of dirt, and no mother would willingly ever do anything to harm their child. And so for these women that are stuck in this, how do you minister to them or help them to get past that?
Well, one thing that I'm trying to do is actually I'm trying to change that mentality that if you're struggling with an addiction, you're a bad person, because that's not true at all. You know, I am a Christian, and I believe that we're all lost without Jesus. Everybody, every single person. It doesn't matter who you are. It doesn't matter how much money you have. It doesn't matter what your education is. None of that matters. But without the saving grace of Jesus Christ, we are all lost. And so, like, what I want to do is I want to change that mentality with women who think that they're going to come in and be judged instead of loved, because it's not true. I mean, we want them to come in, we want to take care of them, and we want to help them. A lot of times women feel very hopeless, and it's just like you said, they feel trapped. But the truth of the matter is they can get into treatment during pregnancy, and if they get prenatal care and if they get into treatment, they can be good parents. They can take their babies home from the hospital. That CPS is not going to take their baby away. You know, like if they can get into treatment and they can be consistent with their prenatal care, I've seen plenty of moms take their babies home and do just fine. A lot of people are afraid if I come in and talk to the doctor, they're going to judge me and take my baby away. That's not necessarily true at all. What we want to do, our main goal is not to take people's babies away. Our main goal is to get the mother in a state where she can care for her baby and take the baby home. Like, that's always our goal. And as far as like babies born addicted, you're right. Nobody ever says like, I want to have a baby born addicted to drugs. Nobody ever says that. But there is treatment for babies that are struggling with addiction. There's been a system of how to monitor babies after birth for signs of withdrawal, and there is a treatment protocol for how to manage that, just like there is for the moms. So babies can be treated, and I've also seen plenty of children that were in the hospital for a prolonged period of time because they were withdrawing that do fine, that do great. They're beautiful little babies that are healthy and that do fine. So I think that we just need to change the mentality from judgment to hope. Like, there's hope. Like, there's hope to change your life. There's hope to get into treatment. There's hope to be a good mom. And a lot of people feel beyond hope, you know, at that point when they get pregnant. Now, not everybody who struggles with addiction and comes into the hospital is going to get to take their baby home, you know, and really, honestly, like, if you're at that point where you're really still struggling, you need to take the help that's available to you for your child to be in the best place possible. And most mothers want what's best for their children. And some women relapse over and over during pregnancy. It does happen. But some women do successfully stay in treatment and get to take their babies home. And, you know, I've seen some women, I've been in Richmond for 6 years, I've seen some women that with a prior pregnancy, they struggled the whole pregnancy, and then they come back pregnant again later, and they're in treatment and they're okay because they didn't give up. And then they take that baby home. So it's like what you said, women feel trapped, they feel judged, and like, I really want to change that, because I don't view pregnant women, I don't judge them harshly, because I know that we're all lost and that nobody has hope without Jesus. So I really want women to feel like they can come in and be taken care of. And honestly, they will be respected, just like any mother in the hospital. No one's going to treat them any differently at all. We're just going to do our best to take care of them. And I will say, if you do choose to get prenatal care, which I hope you do, any woman that's struggling with addiction, I would encourage you to be 100% honest with a physician, to just completely talk about everything that you're struggling with. Talk about if you're struggling with substance abuse, if you're struggling with mental illness, any type of substances that you're using. If you relapse, I would encourage you to be 100% honest, because if you're honest, we can help you. If you're dishonest and you try to hide things, we can't help you. And a lot of women do end up hiding it, and it doesn't come out until later. But if you're honest and you're open and you tell us everything that's going on, we're not going to judge you. We're just going to do our best to help you, and our goal is for you to be healthy and take your baby home.
I know the more that I listen to you speak, it's just not common for a doctor to have that much compassion. Like, you have so much compassion, and you talk about Jesus. I mean, you don't take the credit, is not, in my experience anyway, with the doctors that I've met. It's just nice to know that there's someone out there that really is 100% into what they're speaking. And I know you a little now personally, as well as being a doctor, and it's just nice to know that the women that are struggling, that they have somebody, and I refer you to anybody that I know that is pregnant and in active addiction, because I know that they're going to get that compassion and love with their care that they need for the baby, and so that helps me out, I know. So you kept saying hope, and it's got me over here thinking, like, what kind of what could we give a name to for a doctor's office, or something just strictly for women that struggle, that are pregnant, and so you got my mind over here wondering, Home of Hope or
Home of Hope. Well, I currently work with Reed OBGYN, and everything that I'm saying is my own personal opinion and how I approach practice. But I can tell you that if you come to our office, we have a high-risk pregnancy coordinator who is wonderful. Her name's Maria, and she connects our patients that are struggling with addiction with the community resources, and we also have resources at Reed now, and it's something that's actually growing. But, if you do choose to come to us, and if you choose to come see me, there are resources for you, and you're going to be loved and respected, and you're going to, like I said, our goal is for you to take your baby home. Like, that's what we want to do. Like, that is our final goal. Our goal is not to judge you. Our goal is not to take your baby away. And like what you were saying before is, like, you're not used to doctors who are really that compassionate or care about their patients. It all just goes back to the fact that I know that everything good in me, I give credit to God. Mm-hmm. Everything good in me, I give credit to Him, because everything good in me is Him. So I feel, like God loves these pregnant women that are struggling with addiction. Like, God loves these little babies, and He wants to reach out to them. And I view these women just like me, like without Jesus, without hope. And I want them to come in and feel like someone does care about them, like someone does love them and want to help them, so that they can find hope too.
When a child is born addicted, what happens after that? Like, how long I know there's the extra stay in the hospital normally for babies.
Question.
I know that there's I forget what it's called, but it's where people come in and rock the baby. They have that now, right?
Yes, absolutely. So if a mother comes in and has a positive tox screen and there's concern about the baby potentially being addicted, sometimes it can take up to 72 hours before babies to show any signs. So generally you can expect the baby to be in the hospital for about 5 days, just being monitored for signs of withdrawal. We have something called Finnegan's scoring, which basically looks at different signs of withdrawal in the baby, and then it triggers when we actually need to treat the babies with medication to help them. But there will be a prolonged hospital stay for the baby, at least 5 days, and then if the baby ends up needing to be treated, then longer. But we do have people that come in. We have these wonderful, experienced moms that come in and love and rock the babies, and our nurses are extremely experienced with how to take care of the moms and babies and people that when you're looking for that in a baby, they're very well trained. And so, but like I said, the atmosphere is, we want you to come in and have a beautiful birth experience, just like any mom. We want you to come in and have a beautiful birthing experience, and we want you to come in and feel cared for, just like as if you had never been dealing with addiction. And that's what we do.
Good. Mm-hmm. Terri, you have family that work. Is it the baby mother unit?
Mm-hmm. I have a niece that works there. She's been there, I think, since she graduated. I have a daughter-in-law that is going back to school to get her nurse practitioner license, and she works there also. She's just a couple days a week now, since she's in school pretty much full time. But when you're talking about rocking these babies, I'm thinking, okay, I think that's awesome, and just to be able to have that opportunity to do that too. Susan's always telling me that she doesn't like it when I have the ice cream store open, so she can use me more to help her, but this rocking the baby thing sounds awful good, Susan.
Yeah.
But it's great because I think that just like with when you're talking about you want them to have a happy birthing experience, and I mean, when they're carrying that burden of the addiction struggle to start with, and this is a little different situation, but I have a grandson that when my daughter-in-law was 4 months pregnant and they did this sonogram, they found out that he had a bilateral cleft lip and palate, and I remember it was just devastating, initially, and I'm thinking, oh my gosh, they tell you this at 4 months, and so you've got that other 5 to think about it. But their philosophy was, we want you to have a normal, happy birth experience, and if you didn't know this ahead of time, and then it just happens and it's sprung on you, you lose that. And so then I understood why they did it the way they did, because we had a normal, happy birth. We weren't shocked when this little thing was born, and I think the same way with the moms. If everybody knows this going in, then it's not a surprise of how this baby might be, and the mom gets to still have something normal as she can.
And we do try to prepare our mothers for what to expect. And for our mothers who are in general, if you are struggling with like an opioid addiction or you're struggling with heroin, we like you to be in treatment. It can be dangerous for babies to withdraw when they're in the womb. After the babies are born, we can monitor their withdrawal and take care of them. But when they're in the womb, we can't do that. So sometimes women who rapidly withdraw during pregnancy or who are kind of off and on using, it can hurt the babies and maybe even result in miscarriage. So we encourage our moms to get into treatment. And if you're already dependent on opioids, I mean, you're using prescription drugs off the street or you're using heroin, in general, we want you to be on a medication to prevent withdrawal of the baby in the womb. And if you stay on that medicine and you stay in treatment, and sometimes the babies don't actually withdraw. So not all the babies will actually withdraw. Some babies do fine and don't even need extra medication. But a lot of times, if the babies do withdraw, we treat them with morphine in the hospital and then gradually wean them down so that we can monitor their withdrawal and make sure that they're healthy during it. One thing that I do want to comment on, since we were talking about birthing experiences, is in most situations for our moms in treatment, we encourage them to breastfeed. So if you are taking Suboxone or Subutex or on methadone, we encourage you to breastfeed. It can even help with the baby's withdrawal. So like if breastfeeding is something that a mom's interested in wanting to do, we certainly encourage them if they're in treatment. We don't encourage them if they're out actively using to do that, or if they have a disease like HIV that can be transmitted through breast milk. But even women with hepatitis C can still breastfeed. And we definitely will encourage our moms to breastfeed their babies. We have our babies in the nursery that are struggling with addiction, and we have our moms in there, learning how to care for and breastfeed their babies. And we actually encourage them to be there the whole time that the baby's in the hospital taking care of their child, so that when they go home that they're ready to do it. So
sounds good. I didn't know that. I had never thought about having them breastfeed, even if they're on medicated treatment.
Absolutely.
I mean, it makes complete sense, but I had never thought about that.
Yep,
it's good information.
Yeah, absolutely. They can breastfeed, and we encourage it.
So if they choose to breastfeed and they're on medicated treatment, eventually when they're not being breastfed anymore, do they go through some kind of withdrawal?
No, most babies kind of gradually wean off the breast anyway. So generally it's not an issue. Like if a mom is in treatment and a baby ends up needing morphine and gets weaned off morphine, the mom should still breastfeed. Babies gradually kind of wean with breastfeeding anyway. So generally it's really not that much of an issue with our moms.
That's different to learn. I'm shocked to think about that, but that's a good thing to know for when somebody comes in for help with us. and they're pregnant, and so for them to know that, that's a big deal to me. A lot of families don't understand when somebody is pregnant and they're in active addiction. It could go a couple different ways. People don't understand addiction anyways, but to have someone that's pregnant and in active addiction, what could you say to family members to help them? If they're pregnant, they need treatment, they need prenatal care, and they don't need all the stress that goes along with the judgment either. What could you say to the family members that may be struggling with this?
Well, I feel that family is 100% important for these women, because a lot of times women who get into treatment during pregnancy are in toxic environments. So they're surrounded by people who use, they're surrounded by people who are not likely to support them in recovery. So family is 100% important, and it can be difficult. A lot of times children or sons and daughters are estranged from their parents because of drug use. But what I would encourage parents that have a child or a cousin or a friend that's dealing with addiction is that they really need you. Like, they need you. They need that support. They need to get away from that environment where they're surrounded by people that are using, and they need to get into a place where they're around people that support them in their pregnancy. And I've had young women who have been in addiction that moved back in with their parents and didn't leave the house. And I'm like, that's okay. Like, if you don't leave your house, for the rest of your pregnancy, that's fine. You need to make sure that you really change the environment, and I think family and friends is 100% necessary in that. It's hard for them to be successful without that kind of support. Not everybody has a family to go to, but I would say if you do have somebody that's struggling with addiction who's pregnant, and you want to see them healthy and that child to be healthy, that they really need to be fully embraced. Even if they relapse, even if they're still struggling, they need to have an opportunity to get into an environment where they can get away from that crowd that was using.
The thing that's kind of speaking to my heart is selfish. People think that an addict is selfish. And so it goes a little deeper when you're pregnant, then you're even more selfish. And what's the best way to share with somebody? To me, I know I'm not selfish. But I was trapped in that addiction that consumed my life, and so as it consumed me, my thoughts of rational thinking was gone.
Yeah.
And so, what could you help them understand with that?
I would just say, addiction, it's a medical condition. These substances alter your brain chemistry. Like, a lot of times people really cannot stop on their own. It's not just a matter of, oh, I'm pregnant, I don't want to hurt my baby, so I'm not going to use anymore. Like, they cannot stop. Their brain chemistry has changed. I think if you try to view it more objectively as a medical condition, you have diabetes, you need to get treatment. Diabetes in pregnancy can be very dangerous. It can result in the death of a child if the mother does not properly treat her diabetes during the pregnancy. Addiction is the same thing. I mean, it requires treatment. It's a medical condition, and women don't have a choice, and they can't just turn it off and say, okay, I have a baby now, I'm going to stop using. It's not an act of using during pregnancy is not an act of selfishness. It's an act of having an illness. And I think if people approach it that way, they'll be less likely to judge these women harshly.
Terri, do you have anything else that you would like to talk about?
When you were saying that, you so wish to educate people and so wish just to understand. It's not that they have to like it or condone it, but just to understand it. And I was just telling my husband the other day that people that are bound by addiction are enslaved, and the substance, whether it be heroin or whatever it might be, it owns them. It owns them. I mean, I see it. It's so easy, like you said, for them to think, well, they should just stop. And if they could, we wouldn't be here having this discussion. It's not that simple. And, it's, they're owned. and it rules. It has the final say, till that pivotal point comes for them that I'm done, and then the work starts. But it's especially, I think, like you said, with someone that's expecting, we all just, it's like, even the mother knows different, but it's still not as simple as just saying, I'm not going to do this anymore. I'm pregnant. It's not that it can't happen, but it's just about impossible to do it on your own.
Yeah, I haven't taken care of a single woman. I haven't taken care of a single woman who's been addicted during pregnancy who said, I want to willfully hurt my baby,
No.
or who said, I plan to have a child, like I want to, or I plan to have a child born addicted.
Mm-hmm.
Not a single woman.
No.
And it seems like after birth, the attitude of the mother probably changes a lot when she sees her child in withdrawal.
It can be hard for women to see their children in withdrawal. It can be. And we do try to counsel and prepare our women for what to expect, when they're in the hospital and when their baby's withdrawing. But their babies can still be healthy. Like, we encourage them, your baby, if you are in treatment, if you're out on the streets exposing yourself to dangerous diseases and exposing your baby to dangerous diseases and, withdrawing out in the streets and then using again, which isn't good for babies. If you're out doing that, that isn't good. But if you can get into treatment and successfully stay in treatment, you can have a healthy baby that is treated for withdrawal, that goes home healthy. And then you can have that special moment where you bundle your kid up in the car seat and, have hopes and dreams for your kid's future. That special moment that all moms have when they leave the hospital. Like, they can have that. They can take home a healthy baby. We just need them to get in and get prenatal care and to get into treatment.
Mm-hmm. Well, we want to thank Terri for being the co-host, and for Erika to take time out of her busy schedule to just help encourage others that may be pregnant and they don't want to go to the doctor because they're in active addiction. We encourage you to go to the doctor. We encourage you to find a physician that will be there to just help encourage you for all of your prenatal care, and also that can guide you to your treatment, to your recovery treatment. And so we just reach out to you if you're listening to this program and you're struggling as the parent that you don't know what's going to happen to your grandchild. The number on the screen, we can help answer some questions that you just may not understand. And so we are here to help listen to you, to help connect you, and to help motivate you. And we ask that you just keep Unchained Praises continuously in your prayers as we continue to reach out to those who suffer, to those who don't know where to go or what to do, and to just continue praying for us as we continue to work one-on-one, doing recovery plans with individuals. And we just want to thank you for visiting us at Let's Talk Recovery.